Living Longer, Living Better is your television magazine highlighting lifestyles, hobbies, sports, health, travel, people, and places in our community, and much more. Information, ideas, and knowledge that will encourage new thinking and provide insights into our community. Plus, sharing fun activities of all types, understanding options for financial well-being, and making life more enjoyable. Join us on the journey exploring the many facets of living longer, living better.
Well, welcome back. It's great to have you here. I have Dr. Helen Hong, and she is a wonderful dentist, and we're going to be discussing all kinds of advances that they're making in dentistry.
Yes, we are.
Well, thank you for coming, and tell our viewers how you got here. How did you actually end up being a dentist?
How did I end up being a dentist? Well, I kind of found my way into dentistry by accident. I think I had a love for literature. I had a love for the Spanish language, and I thought I was going to be going to graduate school in those two fields. However, my family was persistent. My mom's a nurse, my dad's an MD, he's a ENT, and they really thought that because I was strong in my science courses that I should really look into the health services. And well, after looking at everything, and actually going to a dentist myself as a patient, I ended up deciding to go into dentistry because it's a great career, and it's helping people and keeping the mouth healthy.
And that is the key, isn't it?
Yes.
I don't think people realize it's like happy, they go happy wife, happy life, but it's happy mouth, happy health.
That's very true.
It's amazing how it ties back.
I think it's overlooked very often. People tend not to think about the mouth because generally, at least for 65 plus, they don't have health insurance unless they buy it themselves, and so it's disregarded. Medicare, helps a lot of the 65 and older with health care, but not for dental care, and so because it's an out-of-pocket expense, oftentimes it's overlooked and it's only thought of when the person has pain. But if you think about it, a lot of all your nutrients come in through the mouth. And so if you're not taking care of your mouth, you can't have a good diet, a good balanced diet. You can't feel comfortable socializing and feeling good and looking good.
It's so important. I mean, I think it's nice to see that a lot of focus is coming back on, and I love the preventative measures that they're coming up with. I know that we're going to speak more to the seniors, but just the flossing, just making sure that you take care of, like you would exercise. It's like exercising your mouth, isn't it?
It is. And sometimes it's, habits, that they've learned from their, that people have learned from their parents. If they don't learn good habits, it's certainly harder to instill. But if they do realize how important it is and how much money it saves if you do the basic stuff every day, cleaning your mouth after meals. So a lot of people, what they do is they'll eat, they'll brush their teeth and then they'll go eat breakfast. And then when they take off, the clean teeth has now been covered with food. So I remind them, you want to brush after you eat. And then after that, for that period of time, you will have clean teeth.
And a pretty good smile. Now, and I see a lot of, now talk to me about the braces that I see coming up now. The Invisalign, the braces. I mean, I know I got my braces, 31, 32, because I just wanted them and I could afford them. So I got them. But it was so nice to have that done.
The clear braces is a great option for adults. They don't want to go around looking like teenagers, and also it feels uncomfortable. But the clear braces, it's like a clear plastic but very rigid mold to your mouth, and you clip it on, and it applies pressure to your teeth little by little until it makes your teeth straight. And you switch them out every 2 weeks. It's great, it's computer generated, it's very high tech, comfortable, keeps your, you looking normal, and easy to comply to.
That was the hardest thing to do, is to have the metal, because you were not high tech when I was 31.
No.
You know, but I have to tell you that you had to be careful because the little bands go ding if you forget to take them off before you go out to dinner.
Yes.
And so to see that beautiful hard-cased plastic, it actually looks so high-tech.
It definitely is kind of the part of the decision making. A lot of the adults, they don't want to have that difficulty where, you know, they have things where food gets stuck and that it doesn't look good. So having the invisible braces, the Invisalign, definitely helps them think about it more seriously and actually do it.
Now, what would you say your percentage of adults doing this now is, say, compared to even 5 to 7 years ago?
Well, teenagers are included as well,
Okay.
because, you know, they want to look good too. They don't want to be in braces, in the metal braces, while they're dating and you know, going out socially. So I would say those who need braces, I would say, you know, a vast majority. I can't give you a number because I don't know off the top of my head.
But just in your business, have you seen a dramatic jump
Yes.
to these Invisalign?
They think about it more. They think
Okay.
about it more than if they were offered the metal braces. I would say if they were given the choice, they would say yes, like 70% of the time, 80% of the time.
Well, and teenagers are very aware of how they look and how they react with their peers.
Yes.
To me, that I taught
They
in
would-
high school, and looking good is everything.
They would rather have, you know, a poor bite, crooked teeth than have the metal braces. Yeah.
Well, with that, we're going to take a quick break, and then we will be back, and we'll talk about the older people who've been through more, so they're not quite so embarrassed to not be looking good. The end result is always important for them. So stay tuned. We will be right back.
Bobby Decker is a realtor that cares about community. Few things say more about Bobby's commitment than her support of many of our local charities.
One of my favorite things to do is to give back to nonprofits that are in our communities. Peninsula Humane Society, which takes care of our furry little friends, making sure none of them are abandoned. To Career Closet, which makes sure that the women who go there are outfitted with clothes so that they can get jobs. To College Track, which ensures that the students are not forgotten halfway through their college career. They have enough money to actually finish. And then there's Build, which helps miniature entrepreneurs become big entrepreneurs. All of it's giving back to nonprofits that make a difference, and that makes me feel good. And welcome back to Living Longer, Living Better. And our guest today is Dr. Helen Hong. And you know, we're going to leave the youngins behind and their braces and jump into the elderly, or even not the elderly, the aging boomers. So let's discuss. You said something really interesting off camera.
Well, I did want to mention that I noticed even with my patients that they're used to taking care of everyone else except themselves. And when they actually get to the point where they have the kids out of the nest and, you know, everything else is settled, when they look to themselves, they do what's called patchwork dentistry, meaning, you know, they take care of little things or they put off things. And yet, I've seen people have difficulty later on in their 90s because they've chosen to do something patchwork rather than comprehensive. And the reasoning that they give, which makes me sad sometimes, is they say, you know, I only have a few more years left on this earth and I don't want to have to spend that money. But, you know, who better to take care of than yourself? Because if you stay healthy, you can be around longer, have a good quality of life, you know, enjoy your time with loved ones and be healthy.
Exactly, exactly. And I know that with healthy teeth, you should have healthy gums, because without them, you can't have the healthy teeth.
Yes.
So let's talk a little bit about that. You were talking about some of the gum disease causes, and they were saying smoking and hormonal changes and medications. Medications, I thought, was quite interesting.
For medications for gum disease, anything that causes dry mouth. And so dry mouth is a common syndrome with the 65 plus, because they end up taking medications for hypertension, for cholesterol, for heart conditions, seizures, and if they are dealing with Alzheimer's and Parkinson's disease, that also comes into play, as well as pain meds. And all that, what that does is it depresses the salivary glands, and they don't produce enough saliva. And when that happens, everything dries up, everything becomes sore, you can't eat well, you can't swallow, you can't speak well, and that contributes to gum disease.
That's amazing. It is just, and then with the gum disease comes the loss of teeth, yes?
Yes. And so if you don't take care of your teeth, if you're not brushing well, if you're not seeing your dentist regularly, you can build up what's called tartar. And as well as if you have medical conditions such as diabetes, AIDS, cancer, all the things that prevent your gums from healing well come into play. But if you don't take care of your teeth and the buildup happens and they start to creep down the roots, your bone and your gums want to get away from that bacteria colony. And so when they do, you lose more and more of what's the bone that's holding the teeth in your mouth. And oftentimes it's a silent disease. You don't realize it until your teeth are starting to move and you realize you can't eat the types of food that you want. You can't eat, tough meat, hard bread. You have to stick to a very soft diet like porridge. And that affects your diet and that affects your health.
Well, how do you go about correcting that? Because it says, it needs to get corrected. It's not normal. And you say that you should do it in conjunction with your dentist. But how do people know?
Well, people know that they have, people often don't know that they have gum disease until it's progressed to a point where it's severe. And so the best way to prevent this from occurring is to deal with it earlier. So do your home care, twice a day at least, 2 minutes in the bathroom, brushing your teeth well, definitely flossing, because food and plaque builds up in between the teeth and those need to be cleaned out as well. It doesn't come off when you just brush your teeth. And then going to see your dentist and your hygienist regularly, at least 1 to 2 times a year, sometimes more if you tend to get buildup faster. And then other times when it's gotten so severe and you're having pain, oftentimes there is no option except to remove the teeth. And if the bone has receded, then your options become a lot less, because certainly there's a lot of new things such as implants, which can restore the teeth nowadays. And so, but that needs bone. So if you don't have bone, it's tough. And dentures then are the only options.
And do you see more and more people trying to do the bone grafts?
They are doing the bone grafts.
The tooth.
Sometimes, so if it's, can I get technical?
Sure.
Okay. If you have horizontal bone loss, that's very difficult to restore. And so you need to find bone somewhere else, whether from the hip, parts of your body, other parts of your body, and it's grafted on. If it's the height of the bone is still there and it's part of it that's receded, then you can build it up artificially. But if it's a horizontal bone loss, there's no way to build it up vertically except by augmenting it from bone from another body part.
And that sounds expensive.
It is very expensive and very involved.
And takes a long time.
Takes a long time.
Chances of success, good?
It is good if it's bone from your body. But,
see, that's...
yeah.
So then all of these, we're talking, there's another slide that we have about the oral cancer and the fact that that increases when you smoke, and yet you see so many people still smoking.
Yeah.
I don't know. Chewing tobacco, all you have to do is watch the World Series.
Yeah.
All those baseball players, I'm like, don't do that, that's bad for the little kids. And then drinking alcohol and excessive sun exposure. Explain that,
sunbathing.
Doctor. Really?
Sunbathing.
How?
Even your skin. It can occur around your lips. Is the oral cancer? I mean, that's considered part of the oral cavity as well.
Okay.
So certainly, 65 plus, they deal with a higher incidence of oral cancer. About 10 out of 100,000 people have oral cancer, and of that, the 60 to 70-year-olds are the ones that have it the most. So you're most susceptible during that age period. So you do want to make sure when you go in for your checkup and cleaning that you get the oral screening. They have great devices now where they can illuminate your mouth and see, if there's any irregular tissues, and that's very non-invasive. It's just a light being shown in your mouth, and if anything looks irregular, then the referral is made to a specialist to get that biopsied.
That is amazing, because everybody, you're absolutely right. People say dentist hurt, dentist fear, and now you're getting these non-invasive or invasive. Yes, and I can see that we have got to break for one more announcement, and then we will be back to discuss the rest of this. It's just absolutely fascinating, and we'll talk about solutions and how to keep your teeth healthy until that very, very last day. You stay tuned.
Bobby Decker is an award-winning veteran of the real estate industry. She has assisted hundreds of clients in Northern California to buy and sell properties successfully, as well as educating the public via her television, web, and/or newspaper articles.
As a former high school teacher of biology, my students' success was my #1 priority. Now, as a real estate broker, educating and informing my clients and readers and viewers is my new priority.
And welcome back. We're with Dr. Helen Hong, and she's telling you how to keep your mouth healthy, how to keep your teeth, how to just lead a healthier life, because if you don't have a healthy mouth, you don't have a healthy life because of the nutrients. I think that's just fascinating, and people forget that connection. So we were talking about some of the solutions that you can come up with nowadays for some of these issues, the implant dentistry that you were just talking about with the bone grafts and all. How about crowns and bridges? Have they advanced a lot? Are they pretty similar to what they used to be?
Crowns and bridges are pretty similar to what they used to be, except there's newer materials. So you don't have to have all metal crowns and bridges. You can have something that looks more tooth-like and natural. There's a product called zirconia that's used to make bridges and crowns, and that's a tooth-colored like ivory color, and that could be adapted to different types of shade according to what your teeth are like.
Oh. So you've got inlays and onlays and veneers.
So veneers are porcelain, thin porcelain covers for the fronts of your teeth. A lot of people have deep, dark stains on their teeth that are internal, so not external. External can always be polished off, cleaned off, and made to look nice again. But anything that's intrinsic can't be polished away. And so if they don't feel happy about their smile not looking bright, they can have something called veneer. They have very thin veneers that make it very non-invasive, and not much tooth structure has to be removed in order to do that. Inlays and onlays are basically lab-made fillings. The larger the filling, the better it is to have something strong and durable. And if crown is not an option for you, an onlay and inlay is better.
And then we were talking about mouth guards and sport guards. We see lots of them. I see football players wearing them during games.
Sports guard is great as a preventative tool. They have sports guards now that have little holes in them so that you can actually breathe. And there's actually one that's made by Under Armour that's supposed to help heighten your ability to play. And so I don't know if that's gimmick or if that's for real, but they sell it and people use it, and they do say it works. But it protects your teeth from any trauma.
And what about TMJ?
TMJ happens if you've had trauma to your jaw joint. Sometimes if you are clenching or grinding hard, that can aggravate it. And also if your bite collapses. So if you start losing teeth, as you lose teeth, then your mouth becomes smaller. And as it becomes smaller, then it shifts the way that your jaw joints sit in your bone. And that can cause strain over time. And so if that's not addressed, then you can have difficulty opening, chewing, talking.
And then the teeth whitening, which a lot of people who after 65 just go, oh, I have to have the teeth. Now, is there really something you can buy at the drugstore that's as effective as coming to you?
Yes, I say it's like taking a taxi or taking a bus. So you can achieve, similar results. It just takes longer with the products at the drugstore because they have to be FDA compliant. They can't be something so harsh that that a person can do it without hurting themselves. Whereas the whitening gels that we use in our office needs to be finely controlled. So it needs to be isolated. Your tissues are isolated, so only your teeth are exposed, and then the whitening gel is applied, and that's pretty strong. And that's an in-office whitening that's done, and that gets a great result.
Yeah, I've seen that. They always make fun on Saturday Night Live with them being way too white.
Oh, yes.
But actually, it looks like...
usually the advice is matching the whites of your eyes. I think
cool.
that's typically what they say, or just maybe one shade lighter than that if you want to go.
It's just amazing. Amazing what they come up with. Okay, tomorrow's dentistry. We were talking about how technology helps, but rather than diving into that, you've got your digital x-rays, everything being less evasive. Is that right? Or invasive? Invasive. You've got your diagnostic lights you were talking about for the cancer, your laser dentistry, which I find fascinating.
Laser dentistry is quite fun, but it's not mainstream yet. I think there's a lot of prohibitive things for the majority of dentists to jump on board. But it is really interesting. It's great for kids because you can often do the cutting of the teeth and cleaning of the teeth without even getting them numb. And so a lot of the kids are scared of the needle and getting numb, and so that's a great tool to have. It's also used for cutting tissue and trimming tissue away, and a lot of times with that, the person heals very quickly when it's treated with laser.
Oh, really? Well, there was another thing that we were going to talk about or touch upon with laser is the pain, but tomorrow's dentistry, what is biomimetic?
Biomimetic. Well, that's actually something that's being done currently as well. It's basically trying to replicate what your natural tooth is like. So any products such as fillings, crowns, all the chemicals involved to kind of placing the filling. They want to create something that's very tooth-like, natural tooth-like. So it mimics exactly how your enamel is, how your dentin is.
Oh, wow.
Yeah, so that's really the movement now in dentistry, as well as prevention. So there's something called carie-free, which deals with the bacteria in your mouth. So if you are prone to having cavities, you go in every 6 months and you end up with like 1 or 2 cavities. That's something to consider because basically what it does is it cleanses your mouth of all the bacteria, and which includes the acidic bacteria that cause cavities, and it allows the new bacteria to come in and hoping that it'll be more normal, more balanced.
Well, we have just talked about so much. Tell our viewers, because we only have a couple of minutes, what do they do as far as insurance? Because it's not much.
Yes, for insurance for the 65 plus, you can supplement your Medicare. You have to talk to your insurance provider for that. They have packages where you can add in dental with your hearing aid and with your vision, and that runs about $30 to $40 per month. You can also get it independently, just as how small business owners do it. So AARP is great. They also have some options to purchase insurances through them. And also something called libertyplans.com was also good. I'd steer people more towards PPOs and indemnity plans and not HMOs, because HMOs are limited to those dentists, those very few dentists who take HMO. And sometimes you have to travel across the bay or down south, or different places, a couple of towns across, in order to get to somebody who takes HMO. Right. So you want to find out, what your dentist takes and sign up for plans that are compatible.
You've just been a fountain of knowledge today. Thank you so much, Dr. Hong. I really appreciate it.
Thank you.
And if you have any questions, don't hesitate to give her a call, because remember, these programs, Living Longer, Living Better, Real Estate with Bobby Jack, they're all here to give you the information you need to make wise choices. And you have brought us all the way from teenagehood up straight through to the HMOs. What's good and not good. So again, thank you very much for being here, Dr.
Thank you very much for having me.
And do come back and see us, Living Longer, Living Better. We will have more. We're going to keep you healthy and happy and moving forward. And the boomers just aren't going to age. So thank you again. See you next week.
Today, Sotheby's International Realty, bringing new technology to a 200-year-old tradition while serving the San Francisco Peninsula, Silicon Valley, and clientele worldwide.